Have you ever experienced high blood glucose on a ketogenic diet? It's not altogether uncommon, and there are a number of reasons for this. So today we're going to talk about several of those reasons in this video.
All right, so let's start with maybe one of the things that's the most common, especially when somebody is starting a keto diet, and that is the dawn effect or the dawn phenomenon. More noticeable in some people than others.
Right. So the dawn effect is a circadian rhythm kind of thing with different hormones, and those hormones are cortisol, glucagon, adrenaline, growth hormone. Insulin is in the mix there too. But between the hours of 4 and 8 p.m., your body kind of starts gearing up to wake up.
4 a.m.?
Yeah, 4 to 8, yep.
Yeah, I think you said p.m.
Oh. Well, if you're a shift worker, it might be that.
That might be.
But yes, we're going to go with kind of this traditional nighttime sleeping.
This is the hormonal cocktail that we all get early in the morning around 4 a.m. Usually what they say it's starting up. But this is truly what wakes us up. It's not the caffeine. This is what truly wakes us up and gets us
caffeine helps.
It does.
So what happens is your body goes through this cycle and it wants to start waking up. So all these hormones, their job is to kind of get all the processes moving. That is definitely what wakes you up out of a sleep. And one of the things that they do, that they're responsible for doing, is getting your blood glucose up. And this happens through a couple processes: glycogenolysis in the liver, which is just the breaking apart of glycogen, stored glycogen into glucose molecules, or gluconeogenesis also happens in the liver. So that is the making of new glucose from amino acids, lactate, things like that. And all this is just to kind of get the systems ramped up so you can jump out of bed and enjoy your day.
Right, and for everybody, they will raise our morning blood glucose reading. Now, if you're insulin sensitive, your body counters that very quickly and you get a little bump in the blood glucose and it comes right down. If you are insulin resistant, which many people are when they start a low carb or keto diet, the blood glucose can go up and stay there because you're not able to move that glucose.
Right, and this is exactly what happened with us, because I was definitely more insulin resistant and I would be getting higher blood glucose readings in the morning, especially in that first year that I was doing keto. Yeah. And you never would. You would never have that. Yeah. But this effect is going on in both of us. It's just that your body is able to take care of that little raise in blood glucose very quickly.
Yep.
Mine was just like the blood glucose is there and the cells are just saying, yeah, we're not ready.
Right. Well, and this is very common when you get started on this type of lifestyle, this low carb lifestyle. What we see in some people is that they've been following a keto diet for months and months and months, and then surprisingly get higher blood sugar readings in the morning. And this can be explained by the next thing that we're going to talk about, which is adaptive glucose sparing.
Right. Now, you actually got kind of turned on to this by some questions.
Yes, thank you. So in our Freedom Health program, I'm very active in the forum, and some people were coming to me saying, I'm starting to see some higher blood glucose readings. And I was kind of thinking of some other things that we'll get into here. But then when looking into it, this, I think, is probably the main thing that we see happening, this adaptive glucose sparing in people that have been getting nice normal readings on keto, and then all of a sudden, out of the blue, they start getting higher readings.
Right. So adaptive glucose sparing. It's also known by the name physiologic insulin resistance, which, versus pathologic insulin resistance, which is the bad kind. Mm-hmm. And I think that they want to kind of rename this adaptive glucose sparing just to get insulin resistance out of it, because it gets confusing. Physiologic insulin resistance is a good thing. I mean, that's the way it happens. And what goes on with this is that over time your muscles have gotten used to burning fat for fuel, and they really don't want the glucose. So they actually become insulin resistant to the glucose. When the blood glucose goes up and insulin is there knocking on the door, they're saying, no thanks, we don't need any glucose, we got what we need.
Exactly. Yeah, not a bad thing.
No.
Right? Because the muscles they're saying basically, we don't need the extra energy because we're doing just fine burning free fatty acids. That's a great thing for us.
That's a good thing.
Yeah.
That's a good thing. So the next thing is low insulin. If you've been on a low carb or especially keto for a while, you're probably going to have fairly steady low insulin. You're not taking in anything that stimulates the pancreas to produce insulin. So after a while, your pancreas might be just a little bit lazy or slow to respond to an influx of glucose. So when any of these things like the dawn effect, cortisol, any of these things start kind of raising the blood glucose level up, it might take a little bit of time for your pancreas to say, oh, hey, we got to wake up, we got to make some insulin, and that can cause that kind of, temporary increase in blood glucose.
And in a way, this actually could be a positive sign in that it could be showing that your body is becoming more insulin sensitive. And you can test your level of insulin sensitivity utilizing an equation called the HOMA-IR. We have a video on that, which we'll point you to if you want to get a little more information on it. But what it does essentially is it takes two things into consideration: your fasting blood glucose level and your fasting insulin level. And those two factors together can determine your level of insulin resistance or insulin sensitivity.
Yeah, it's just a relationship between those two things to kind of give us an idea of where we're at. The next thing, and this is something that we've talked about fairly recently, but excess protein. This affects me specifically. Some people not, but definitely me. I've been keeping very, very close track since August. So what are we at? It's over 2 months now. Yeah. Of all my intake, all my glucose, ketones readings, all those things. And I found that if I have a high protein meal, especially an evening meal, and it could be on a day when I've only had 5 grams of carbs the entire day,
right,
my blood glucose will be higher the next morning. And it doesn't happen for everybody, but there is that gluconeogenesis that happens. The liver can take, those non-glucose things from the high protein and turn them into glucose. And that's the only thing that I can really see is going on, is with me at least.
Right, so somebody who is eating a lot of protein might see higher blood glucose readings in the morning.
Right.
Let's go on to one thing that should be noted in this video that is maybe a little bit harder to diagnose, but is still something to consider, called latent autoimmune diabetes in adults, LADA.
So latent autoimmune diabetes in adults. It's pretty descriptive.
Yeah.
It's basically, so it happens, it's an adult onset thing. Your immune system attacks the beta cells in the pancreas that produce the insulin that you need, and you end up not having enough insulin, your blood sugar starts going higher. They actually refer to this as type 1.5 diabetes. I've heard, it might be like 5% of type 2 diabetics. It's not like hugely common, but it is there, and it needs to be taken care of.
And it's only going to be diagnosable by your doctor, and probably a challenging diagnosis at that. The good thing, though, is that lowering your carbs, especially getting rid of the refined carbs, should help this, even if it's not diagnosed as.
And the symptoms of this are going to be kind of similar to type 1 diabetes. People are going to be thinner, have a hard time gaining weight.
Yeah.
That's one of the hallmarks of type 1 diabetes. But yeah, it's definitely something that, if you have some concerns there, you need to be checking with your doctor. So let's talk about stress. So stress can definitely be pushing your glucose up. We know that cortisol is a stress hormone. We mentioned that in the dawn effect. So if cortisol is high, one of its effects is to kind of increase your blood glucose. So if you're under, some higher amount of stress, you could certainly get, some raise in blood glucose. If, even the lack of sleep, is a stress. So, if you're just not sleeping well, or you had a fitful night, you could end up with a higher blood glucose rating in the morning. There is such a thing known as stress hyperglycemia, and they have noted this condition over the past couple of decades, and they've looked at it in emergency rooms quite a bit. So what happens is if your body is, if you're ill or if you're injured, the body's natural reaction to that is to raise the blood glucose level. If it gets too high, and in some people it can, this is this stress hyperglycemia, it can cause issues. And they found in emergency rooms that repeated episodes of this, people who either were injured or ill, in the emergency room a number of times, that's just, it's either bad luck or bad choices, I don't know. They found that those people were, they had a higher mortality rate. They also were 3 times more likely to develop diabetes. So it is one of those warning signals, and ER physicians are kind of trained to really key in on that as one of the diagnostic factors there.
All right, and then we should really round this out with one thing that can happen to any of us, and that would just be simply having a faulty reading due to your meter being off, or just those little strips being affected by weather or what's on your hands, or things of that sort. A lot of things that can factor into faulty readings.
Right. So meters that are marketed to the public have to go through the FDA process. And the FDA allows a 15% plus or minus error in these meters. Now, we use a Precision Extra. I did check into this when we first got it. It has one of the lowest plus minus errors. It's well below the 15 that's allowed. But it can still, you can still have faulty readings. If you have something on your skin, you touch the countertop and maybe there's something from, the night before, and then you prick your blood, that could give a faulty reading.
Yeah, wash your hands.
Wash your hands, yeah.
Well, and so there you go. There are some reasons for having higher blood glucose readings in the morning, even if you've been on keto for a long time. So I hope that video helps out you guys. If you are just getting started on this and you're confused, because there's a lot of information out there, we totally get that. We have a lot of great things for starter. We'll get you on our starter kit, kind of give you an idea how this guy got started when he lost his 80 pounds. So thanks so much for watching. Hope this was helpful. Please subscribe to our channel so that you get to see our next videos, and we'll look forward to seeing you. Thanks.
See ya.